Here we go. If you're looking to keep your skin glowing and youthful, you're in luck, because today we're joined by Dr. Rachel Delost, a board-certified dermatologist with Optima Dermatology in Mentor. She's here to share expert advice on how to prevent signs of aging and maintain healthy and radiant skin. Was that a long rap or what? I see your husband a lot, Greg.
Yeah.
So you guys are both skin people.
Yep, you get the other Dr. Delost today.
I don't want to let any cats out of the bag, though, but you just had a baby how long ago?
2 weeks.
Beautiful baby.
Yeah, he's doing great.
He's doing great.
Yep.
Is Greg, Dr. Greg watching him right now?
He's at home with Grandma. And,
Great. We'll give him a little wave there, right? Well, hey, we're talking about how to keep your skin beautiful and youthful. You are probably the greatest example of that we've had on the show in a long time. Perfect skin. So where do you start? Is it too late to start, like an old guy like me?
You have beautiful skin too, so no, never too late. One thing I always recommend every single morning for everyone, 365 days a year is always SPF. If you're gonna be out in the sun, making sure you reapply, but that's the most important thing for anti-aging. And in terms of topical products, there's tons out there on the market. I really like medical grade products as opposed to the drugstore, just higher grade, better active ingredients. But
so if you're really serious about this, you should maybe come in for a consult.
Definitely.
Come in for a consult and say, this is what we got to work with.
Yes.
Where do we start, or how do we maintain?
Yes, definitely an individualized approach depending on what you're looking for and goals, prevention versus trying to turn the clock back, all those things.
Do people put, like, I remember watching TV in the old days, they show people in shows with cold cream on at night and putting stuff. Are there things you should put on in the evening versus things you put on in the day or in the morning?
Great question. Yes, I don't think it matters too much, but in general in the morning, SPF again, some kind of antioxidant serum to try to help prevent those free radicals from sun and pollution and stuff like that, like a vitamin C serum. And then at night, we usually recommend retinols or prescription strength retinoids and a good moisturizer. Do
some of these treatments or preventative things when you begin cause irritation or friction, and you don't get the result you think you're getting, but you should stick with it, or should you change, or what do you do?
Great question. I get that a lot with the retinoids and retinols. That can definitely cause some irritation at the beginning and redness, but your skin does get used to it over time, and so it is good to stick with it. But again, consulting with your dermatologist on that individualized approach.
I know a lot of young people, they have a lot of oil in their skin, and they get pimples and what they call them, like blackheads or things like that. How do you go about treating something like that? Can you do that by yourself through a little conversation or a little help, or should you see the dermatologist also?
The dermatologist can always help. There's a lot of different options. We can do some chemical peels or hydrofacials or those retinols to help the skin cells turn over.
I've heard something called like blue light. Do people do something like that?
The blue light is more for like sun damage skin and pre-skin cancers
We're
and stuff.
trying to avoid that.
Yeah, red light is more for like the cosmetic purpose.
So when I was a kid, no suntan lotion. I mean, they had like one kind, the kind with the little girl and the dog was pulling the bathing suit down.
Yep.
Or copper tone.
Yep.
That's it. And there's so many different kinds of stuff. So how do you choose what's going to be best for you?
Good question. So it depends. If you have a lot of redness in your skin, we can pick one that has like some green undertones to camouflage the red. If you want tinted or non-tinted, I have lots of recommendations depending on the skin type, or oily skin versus dry.
Yeah. So I see a television commercial on once in a while, and they got the guy with the baggy eyes, and they rub something on his face, and 20 minutes later he doesn't have baggy eyes anymore. Is that
I usually tell patients, do not waste your money on those marketing.
That's a bunch of baloney,
marketing
right?
gimmicks.
Yeah. But if somebody does have those baggy eyes and they want to do something about it, how do you help them?
So baggy eyes is a common complaint.
I got a couple.
There's microneedling with platelet-rich plasma. We can do some filler sometimes. There's lasers, a lot of different cosmetic procedures, and then some topicals can help as well.
Okay, so you get into that program. How is that like a multi-visit? How does it start, and how do you maintain it?
With the procedures, lots of different options. So things like microneedling typically are a series of multiple treatments, like 4 weeks apart, and those help stimulate your own collagen production.
Oh yeah, we have some pictures here.
Yeah, great before and after photos. Microneedling works great for discoloration and scarring, and also just helping to plump the skin by stimulating the collagen.
What's this one?
The BBL laser is wonderful for brown spots and red spots.
Boy, yeah, I could stay there all day.
And then Botox, of course, or Dysport, the neuromodulators to help paralyze the muscles to help with fine lines and wrinkles, typically lasts about 3 to 4 months. And then filler for more of the deeper lines, and that can last up to 1 to 2 years.
That's pretty good, isn't it?
And then last but not least, my favorite, the halo laser, which we have to help stimulate collagen production as well.
I want to ask you about the Botox thing too. I see a lot of places pop up, all of a sudden people are doing Botox and there's no doctor in front of their name. And it's almost like a beauty shop kind of thing.
Yeah.
Is that a potential problem?
Yeah, a lot of problems with that. There's a lot of risks to think about with any of these procedures, but as long as they're done in the professional hands, then it can be great.
Yeah, because I mean, I think I've heard stories of people like hitting nerves and not doing it improperly, and it was like, it's like, you know, a dime store kind of thing.
A lot of times my patients will come in saying, I want filler right here to help with these wrinkles right there, but that's not really a safe option. You could go blind, and sometimes people that aren't doctors might do that unknowingly.
Okay, so I'm interested. I want to go. I want to come see you. So how do I do this? What do I say when I call and set up an appointment?
Yeah, just that you're interested in cosmetics and come in for a consult, and we'll go from there.
Easy to do.
Yeah.
Optima, right?
Optima Dermatology, yep.
Great. Congratulations on the baby boy.
Thank you.
It is fantastic.